My treatment philosophy is pretty simple. It's really important for me to listen to my patients and to get a really good idea of where they're coming from and what their goals are for treatment. I think I can have two patients with the exact same medical problem who need very different treatments just depending on their values and the goals that they have coming out of my treatment. So I like to take my time to actually get to know my patients and get to know where they're coming from. And I think that makes a huge difference in how I'm able to take care of them. So I do practice the full scope of obstetrics and gynecology. Some of my special interests include family planning. I like to be able to provide women with the tools they need to choose if and when they want to have a child. And I enjoy taking care of women during their pregnancy, whether it's a low-risk pregnancy, not requiring significant intervention, or a high-risk pregnancy, perhaps someone who has had a history of preterm birth in the past or had a prior C-section but desires trying for a vaginal delivery this time around. Patients should come to see me because I value getting to know them as a person and understanding where they're coming from to help to formulate the best way to treat them. I'm very fortunate to be able to care for patients at MUSC because I have the support of the institution and various subspecialists who I can work with to give patients the best care. So many of my patients come to me with sensitive issues that they've had a difficult time discussing with other physicians and that have been bothering them for quite a bit of time. By building a relationship with patients and really getting to the bottom of these issues, I'm able to offer them treatment, whether it's just simple education and counseling, medications, or sometimes surgery that are able to have a big impact on their quality of life. So I grew up in Connecticut, up in the cold north, and I did my undergraduate studying at Stanford University where I earned my bachelor's in psychology. I then returned to Connecticut for medical school and received my medical degree at the University of Connecticut, and then went on to do my training in obstetrics and gynecology at Brown in Rhode Island. I practiced in both Rhode Island and in Miami, Florida, before finding myself in Charleston. My husband and I really fell in love with South Carolina when his father retired here a few years ago. And I was lucky enough to find a position at MUSC where I'm able to continue to provide care to women with the support of an excellent institution.